Welcome and thank you so much for joining us this afternoon as we speak on the topic COVID-19 and the effects on the older population. Joining me this afternoon is Alfonso Siverls from New York, joining us via Skype, and also Chante Graham, award-winning documentarian and fellow producer. Chante and Alfonso, how are you guys doing?
Doing
Hi,
great.
Ron. We're good.
Thank you so much for joining us this afternoon as we talk about the older population. I know, Alfonso, you may not want me to call you older, but older and aging gracefully. The COVID-19 pandemic has been affecting so millions of persons all over the world, but mostly those that are more vulnerable to the virus, that those with underlying condition, and also the older population. Chante, let me start with you. Based on what you're hearing on the ground, how are the older population handling the virus, and in terms of the death toll, how is it going there in New York?
Hi, Rose. Thanks, and hi, Alfonso.
Hello.
Well, as we know here in America, period, we have over 216,000 deaths here, and New York City alone had about 23,000. But the older population has been, in my opinion, been held as collateral damage because so many older people have died here, and it's not really a topic of conversation. If you're between the ages of 65 and 74, you have a 90% higher chance of dying. And if you're 75 to 84, you have a 220% higher chance of dying. I had actually interviewed my mom today, and she is 70 years old, and she lives in a over 55 community. And I was just asking her how was she coping, and the worst thing for her is that she can't see her family. And I think a lot of older people living in isolation due to the pandemic and us trying to keep everybody safe, it's definitely affecting their mental health.
It has completely changed. Everything I did before the pandemic, I no longer do. Or don't do to the extent that I did before. I'm completely retired, for one. I was going to retire anyway, maybe worked a little longer. I was working part-time, but the virus speeded that up. I can't do much of the media work that I have done in the past because of Brick being closed. And I'm in a high-risk group. I'm well over 70, and the older you are, the greater the risk. And also, I have some of the underlying medical conditions. People who are older tend to have greater medical conditions. Therefore, I'm at greater risk. I don't have all of them, but, I do have concerns with breathing and blood pressure. And I know folks I know have those concerns, and along with diabetes and heart and cardiovascular problems, and that places people at risk. And what Chante said is right. It's amazing. So in this country, 7 out of 10 people who die from the virus are 65 and over. So it's really taking a toll on people 65 and over. Now, the people are living, much longer. So it's not like these people are incapacitated. People are active, and if you catch the virus and you have preconditions and you're a certain age, the risk factor is there. I live in a community that's a lot of seniors. I live in Brighton Beach, Brooklyn, New York. It's between Manhattan Beach and Coney Island. And there are a number of nursing homes and a high senior population. I remember around June, there was when they were counting the number of deaths by zip codes, and in my zip code there was 1,000 deaths, and a lot of them had to do with nursing homes and elderly folks like myself.
Right. Thank you, Alfonso. Now we go to our own Minister of Health and Wellness, Dr. Christopher Tufton, outline some of the challenges that some of our older folks here in Jamaica are going through.
The interesting conclusions drawn by Professor Shearer in her study was that she has noticed that her seniors that she treats as patients, her patients, their mobility, their movement has been severely restricted because they have literally sat down for the most part over the last 5-6 months. They're not going out because we have said stay at home. That's the messaging from public health. They have not gone to the supermarket. They have not gone to walk around the neighborhood, for example, or even around the house, and it has affected their physical state, which has had an impact on their mental state also. And secondly, family members, parents, their children, who may be busy now tending to their kids at home who are not going to school, are not visiting them as frequently, and in another sense are trying to protect them because of what we say about distancing. But that has now had an impact on promoting the loneliness and the depression and so on. And one of the things we want to promote with this mental health response is how do we reach out in a safe way so we encourage some of the normal activities which are therapeutic to that age cohort.
Also, we went on the street today to speak with some of our older folks as it relates to what they're going through. Let's take a look.
I handle it very good, just as how the authorities say I must handle it. I don't really go out often, but like I have to come out today, I follow the protocol. I wear my mask, I sanitize my hand, I keep my distance. I just do what I have to do.
I notice especially the older folks then, they really take care of themselves, because it's important. Do what is ever to do, stay distant, wear your mask, protect yourself, wash, sanitize your hand and do all those things.
It's not really difficult for you know you do it in order. First thing to commence, you have to have your hand sanitizer and you have to wear your mask. You have to stand 6 feet apart from the rest of people them.
Well, I angle it in the way I know I should angle it. I don't have a problem. If I have a crowd around me, I say social distance and they step apart. They don't close up on me. And when I go home at night, I take off my clothes out the door and I go in.
Well, I'm trying to keep up to the protocol as best as possible.
All right, Chante, let's go back as it relates to communities, clusters, as it relates to how the older folks are handling it and how their children or their support system are helping or assisting them to handle and to cope with the social distancing. Social distancing for them, not just in the physical space, but also they have to do a lot of phone calls, check-ins, persons driving by to drop off groceries. Talk to me a little bit about how that's going there.
Well, actually, I just became I'm actually doing a story on a community garden that's near my home called Phoenix Community Garden in Brownsville, Brooklyn. And they have a program for their seniors where they take food every Saturday, fresh food that is, to the seniors who are shut in and who cannot come out on their own. So over the weekend, I actually did a couple of deliveries with the people from the organization, and it was really rewarding to see that, number one, you get to talk to the seniors, and a lot of times these are the only people that they get to talk to, for the whole week. It's a checks and balances system, because if you see the same person every week and then all of a sudden they don't answer the phone, that there might be something wrong. And it's a way that elders are getting services within the community, as well as pantries. And there are a couple of things I know going on throughout Brooklyn and New York, period, just to get seniors, the things that they need. So I would encourage anybody to check their local, gardens or pantries and try to get involved to do food deliveries. I know Meals on Wheels, they also do it as well. So there are programs that are available And it's a good way to make sure that the seniors are okay, and also to make sure that they're getting enough food to eat.
Right. Also, Alfonso, let me ask you, as it relates to, because you know, being in the house, unable to exercise, unable to go out, and just to be physical is something that is very important, especially when you're getting older and older. It's very important to keep active so that you keep healthier. Talk to me about how you do that. How do you maintain being active and healthy and working out?
It's funny you should ask that, because 20 pounds later almost, I need to do more exercise. I used to be very physically active, but during the height of the virus, that was a challenge for the most part. But now I'm getting more out there because I'm riding my bike. But it is a challenge. I live in a neighborhood where people walk because the beach is there and the boardwalk is there, so people tend to walk a lot. That helps. So they have that form of exercise. But the surprising thing, when that virus really hit in May and June, the streets of this community was empty. People did stay in. So you know, it's challenging to incorporate some exercise regimen if you live in the city of New York. A lot of people still go to gyms, but the gyms are closed. The senior citizen programs are closed. So, you know, what folks said about this social isolation is real. And, you know, I think we have to not only worry about its psychological effects, but the isolation and its physical effects on people, right, because it's connected, and it can create and enhance existing problems and even shorten life. So, you know, we haven't seen the end of this, because when I said my life turned upside down, I'm not by myself.
And it's something that can be extremely depressing, but having the right support system and the right program. For example, our Minister of Health and Wellness, Dr. Christopher Tufton, recently announced a program that is being implemented and persons are being trained for as it relates to offering that support to that special population. Let's take a look.
We have launched this mental health response program to the COVID-19 pandemic, which calls on volunteers. And we are recruiting volunteers to be a part of this COVID response. We are intending on providing some basic training. A manual is being signed off on by PAHO, and it really begins with the basics of listening, just providing a forum for persons who may be lonely, to hear them out, to talk with them, and then they be able to discern if they need additional support. Then you contact the local health center, the mental health nurses, the mental health aides, who will now elevate any attention that is required. There are some basic things like helping them to shop, helping, encouraging walking around the house, even if you can't leave the yard. All these seem simple, but the fact is it can play an important role, and we will continue to speak about this program, and we continue to recruit and encourage persons to get involved. The church, you spoke about, there are restrictions there, but the church is a critical social institution in communities with outreach by members, the pastors, and others. And we want to encourage safe space in terms of the mask wearing and the physical distancing, but not total abandonment, if you will, of persons who need that level of critical support in order for them to cope.
Also, there are other programs that the government and also the Ministry of Health and Wellness has implemented to help the special population and just the entire population of Jamaica. Let me start with you, Chante. What the government there have been doing, what the president there have been doing as it relates to support, offering support to the population to help the elderly or help the less fortunate, help the children. What are those support systems that have been implemented by the president or other organizations?
Well, I can't speak for the president because I really don't know what he's doing. and I don't think too many Americans do as well. But I know in the local communities, people have mobilized within the communities to help their seniors. So I think on a grassroots level, people see the need and they're going out to get things done, whether it's food deliveries or just checking on seniors. I know where I live, we also deliver food within the building to other to seniors, and just being there. If you have a mother or father or grandparents who are older, it's your duty to make sure that they are cared for. I'm not sure exactly what the United States as a whole is doing on that level, because we don't hear a lot about, specific programs that are available, but there are a lot of resources, for seniors. So if, even at the end of your show, we can give you information on websites that they can go on. There are also things set up for mental health if they need, to talk to counselors or anything like that. But I really can't speak on a program that I know about that is being implemented by the government. According to the president, the pandemic is fading away. So I don't know. It's two separate realities that we're living here.
Yeah, can I say something on that, Rose?
Yes, let me ask you, Alfonso, as it relates to what you want to see and also what you see already implemented to assist you.
Yeah. Well, there is no official government program in this country, and that's part of the problem. You take a very progressive city like New York City that has a lot of services, except when this pandemic hit, and you look at the numbers of seniors who died in nursing homes, you would see such a major disproportion numbers. And in fact, they had policies not to send those seniors to hospitals. In other words, leave them in the nursing home to die. And that's just a reality that occurred. I mean, there are individuals who are doing things, but New York City closed down. So churches, organizations was locked down. Transportation was slowed down. So a lot of people were very much left on their own, and it was up to neighbors and friends to help when they could, if they could, because they also had the same concerns and problems. So it was, it's amazing how the city was able to come through it. But would we lose 20,000 people in New York City, 24,000? That's quite a bit. And here's the thing, it's not over.
Right.
It is not over. I don't want to paint a drastic picture, but I want to try to get a realistic picture that for a lot of people, it was a very difficult time, And
that's one of the things that affects the mental health of people.
Yeah.
Just going through the deaths and the part of it that we weren't able to have proper burials. People weren't able to have funerals. So all of this is playing on people's mental health.
Yeah, no funerals. And the thing of it, if you're suffering from depression, and you're a senior, the odds are you're not reaching out. You suffer silently. It's not like you just suffer silently. And I think to some extent that's what's been going on. When we look at, the numbers of elderly who died because of the virus, and so many things that impact their immune system, including stress and depression and loneliness and all these factors. But I think it's getting better. It's getting better.
We can only hope that it do get better, and we do pray for that, because as they would classify Jamaica as a third world country, the strategies and the methods in which our government handled the virus, the spread of the virus, is more of a collective where they have conversation and they propose ways in which they can offer support. It's all about trial and error. If it works, we go with it. If it doesn't work, we pull it back, review it, and keep going, because we're such a small country. And the spread of the virus, especially community spread, is really, really, really a really serious aspect of the virus, because once it reaches into communities, into clusters, and I think that's what something that happened to New York, because New York has such a cluster as it relates to the closeness of persons and apartment buildings. You see the virus spread
easily.
Extreme to the extreme, that there's so many persons that actually contracted the virus. But let me ask you, Alfonso, before we go, what are those things that you would love for your government or organization to implement, coming from you as an older person, to help to support you while we go through this pandemic?
I can target it on some present situations, because we're seeing a resurgence of the virus in New York City, but it's not spreading across the whole city. It has the potential for that, but it's spreading in pockets. So the government has to be very strict about groups of people. And I'm not against any groups of people, but groups of people who will not adhere to social distancing and wearing a mask, because it's so easy to spread this virus. You know, and here's the thing, to counteract the virus is simple. Keep distance, wear a mask. Numbers go down. You don't do that, the numbers go up. The virus is the same whether it's in Jamaica or it's in Brooklyn, New York.
That's correct.
And why is it that Brooklyn has such large numbers of deaths? The United States has such large numbers of deaths. It has nothing to do with income levels and all that, because the things that prevent it are very simple policies. And either you implement them or you don't implement them. So number one, we need to ensure the social distancing. We need to ensure that people wear masks, and people need to, the government needs to enforce with people that science is real. This is not some conspiracy made up stuff. This is real, and it can kill you. And I think those are the two major things that need to be done. And if we have to shut the country down for 2 weeks, we need to do that. It's not going to disappear magically, regardless of what that president said.
Right. Chante, let me go to you real quickly. As a younger person, how are you ensuring that you're safeguarding your mother? And also, what are some of the things that you can advise persons who may have the virus, younger persons, be asymptomatic, don't show any signs of the virus? Talk to us. Tell those persons as it relates to how they can protect the older folks.
It's important for all younger people, because sometimes they tend to think they're invincible. And then there's a lot of misinformation out here. I've heard young people saying that it's a hoax. I've heard people saying that it's not real, it can't affect me, I won't die. But think about your parent and your grandparent and any older aunts and uncles. You may survive the virus, yes, but your family members may not. I have a son, I tell him, wear your mask, social distance, wash your hands, and think about not just you, but think about me, because I'm a little bit older. So, and I'm also more susceptible. I'm over 50 now. So yeah, it has a lot to do with me. And I don't think the young people really get that. So as far as with my mother, it's very hard because she lives by herself. So I make sure I call her every day. We do video chats, you know, and if I do go see her, I make sure if I'm around other people, I self-quarantine for the 14 days before I go see my mother, because I don't want to bring anything to her. And it's very hard. It's hard for her, you know, living alone and used to seeing her family. But we have to think about today and what we have to do now to keep our family safe in the future. I had spoke to an older couple, and they had said that they feel like they're being robbed of their golden years. And
Let's
just
give some pointers as well as it relates to what the World Health Organization say about what we can do. Some simple steps that we can take. Advise older adults and people with underlying health conditions avoid public gatherings and any other unnecessary public activity. Keep the house stocked with at least 2 weeks of essential food supplies and medicine. Shop items online or ask for help from family, neighbors, or volunteers to do your grocery shopping. Also, wash hands. Cough, sneeze into a flexible elbow, or use a disposable tissue. Follow distancing measures issued by local authorities. Clean and disinfect frequently touched surfaces. Avoid unnecessary public activities, but socialize by phone every day with friends. Older adults and people with underlying health conditions are at higher risk of developing severe forms of COVID-19. Protect yourself and stay healthy. Guys, you have to remember that. It's very, very, very important. If you're an older person, please stay safe. If it's not necessary for you to leave home, stay home. Wear a mask when you're leaving home. Keep your social distancing. For us, younger person, we can keep our older folks safe by keeping ourselves safe. Thank you so much for joining us. Thank you so much, Chante and Alfonso, for joining me this afternoon to discuss just how COVID-19 has affected the older population. I'm Rosen Green. Thanks for watching.